Wow, good morning, good morning. I'll take that back. Good afternoon, good afternoon, good afternoon. How's everybody doing this wonderful Friday afternoon?
Wonderful, wonderful.
How you doing, brother?
Hey, man, I'm doing good. But you know why I'm doing so good? What is
Why?
today?
Today is Friday and another episode of the CareSouth Carolina Community Life Podcast.
Man, that's why I'm doing good right there.
Yeah,
That's why I'm doing good.
yeah, me too. I'm just a little bittersweet today though because you know I'm happy we getting a 4 day weekend. Get to unwind a little bit because it's been a really busy 2 weeks for not only us but the medical industry in itself.
Yeah,
We've
yeah,
been busy testing, vaccinating. The monoclonal antibodies been going strong.
yeah,
So I think we earned this rest. Think so?
yeah, yeah, I
Yeah,
think so.
yeah, yeah. And like I said, a little bittersweet because I'm a little sad because the young man in our community, man, 35 years old, 35, passed away of COVID, unvaccinated.
Oh wow.
Yeah,
Oh
35. So
oh
it's
wow.
been a little bittersweet, but listen, we got a great show today. We're gonna get some of those questions answered about the vaccine.
Hmm.
We got two folks that are no strangers to the show.
Right.
Um, Two dynamic ladies. Anytime they come on, we know that the information that we're gonna put out there is gonna be right on the money, and we're
Hmm.
happy to have them. What a way to kick off! And technically, this is our first official podcast of 2022 because last week we just kind of hung out a little bit and
Yeah.
shoot the breeze and kind of reminisced on last year a little bit. So this is our official first
Yes, it
of
is.
2022.
Yeah. Yes. And and what better, like you said, what better way to kick it off than having two of the two of the greatest women that I know to start our year off right, giving us factual based information, and not just giving it to us with just that just give it to us attitude, but also have empathy and compassion, and doing it because of the passion that they have for healthcare and for our communities. So yeah, wonderful.
Can't agree with you more. And without further ado, we're not gonna prolong it any longer. We're gonna let these ladies come on. We're gonna let them introduce themselves and move forward on why we're here today. Like I said, we
Yes.
want to get some information out on the vaccine boosters, of course, but we want to know a lot about Omicron and this new variant. Is it a threat? Or tell us about Omicron, what's going on, and definitely some updates about CareSouth and what we're doing right now. Okay,
Yes.
so I'll let you ladies take it away. Miss Ann?
Okay, I'll be very, very quick. I will be introducing Dr. Kelly, although I don't know why. If y'all don't know Dr. Kelly by now, then you need a really big wake up call. She is the Department of Health and Environmental Control, DHEC's Assistant Epidemiologist. She's been a frequent visitor via Zoom or some other platform at Care South Carolina. And I really want to say something. I am really proud of the fact that Care South, um, well, as of January the 7th, we had 100% of our eligible staff had either begun their vaccination or had the one-shot Johnson and Johnson. And I really have to say that I think that Dr. Kelly's generous time that she gave to us for town halls to give staff this information and the public this information really made a big difference because out of our over 600 staff so far, only 8 staff have decided that they didn't want to get vaccinated and instead would seek employment elsewhere. And that is really major kudos. We are in very, very tough times now. During this past week, at any given day at CareSouth, we had anywhere from 36 to 40 staff on quarantine. We've been following the CDC contingency category for identifying when staff should be on quarantine and how long they should be out, but we had to move um, at least 4 locations or services this week into the crisis category, meaning that if the essential worker was willing and was asymptomatic, we could continue them serving our patients. It is tough, folks. I've been here 40 years and it's one of the toughest last couple of weeks that I've ever been through. Positivity rate stories like Marek just passed on are heartbreaking. Um, but here's some real data from Dr. Kelly, and I'm certainly not going to take up any more of her time because she is packed full of information for you today. Thank you, Dr. Kelly, for joining us.
Oh, thank you for inviting me. And thank you for telling me about what's going on with your staff and with their both vaccination status and how hard you guys are working to deliver healthcare services to the community. It is personally gratifying to hear that maybe I made some difference in people's making a decision about whether to get vaccinated or not. It is so important to get accurate information out there. And it's hard, right? Because people often just read the headlines, they get mixed information, they're not sure what to think. So what I hope to do today is to give you some statements about what's going on with Omicron, but back them up. Show you where is the data that backs up these, the headlines, or help people make decisions for or against not only vaccine, but about other treatments, and understanding all the confusing recommendations we've had lately about quarantine and isolation. Let's try and go through those and pick through them a little bit. It's mixed news. I'm about to show you some scary statistics, but I will also argue we are in a better position this year than we were this time last year in terms of what tools we have in our toolbox to respond to COVID-19. So if we look at what's going on in South Carolina right now, we are having a huge surge in cases. So this shows that the blue bars are the number of new cases each day, and the green line is the 7-day average, the weekly average. And we have successively beaten our own records with number of daily cases, day after day after day. Yesterday, Wednesday, back on Wednesday, not yesterday. Wednesday, we reported 19,271 cases with 31.8% positive, and unfortunately 34 deaths. And those deaths, the age range, the youngest one was 24 with no medical problems. So, when it's true that most younger people do not have severe disease, but it is not true that 0 of them have severe disease. So we've had a huge surge in cases. And if you compare it to this time last year, we're having 10 times as many new cases per day. But it's not all about cases. It's also about hospitalizations. So we'll talk about that in a moment. But I do want to point out that the number of cases are largely among younger adults, ages 20 through 40, and in children ages 5 through 11. You can see that huge surge we had in July, we've got an even bigger surge right now in COVID-19 in children's age 5 through 18. What's different now compared to this time last year is that we have a vaccine. We have a tool that we can use for prevention of disease in this age group. Now, it's not all about prevention of infection. I'm showing you all these great, huge increases in cases, but what's really important are the people who go on to develop severe disease. So we had, 10-fold increase compared to this time last year in cases. What about hospitalizations? Well, we have had an increase. Fortunately, it has not been as terrible as that surge in new cases. So for hospitalizations, we're about 37% higher than we had about a week ago, about 25% higher in terms of people on ventilators, and 27% higher in terms of people in the intensive care unit. So hospitals are getting stressed. In South Carolina, we are not at the breaking point in hospitals. There is still capacity in hospitals, but you can imagine how difficult it is for hospital personnel to be here more than 2 years out still dealing with this. But the good news is that we have not had as bad a surge in severe disease as we have had for just cases alone. What we are seeing is a surge of hospitalizations among the unvaccinated. So here is some data from January 12th from the South Carolina Children's Hospital Collaborative. On that day, it was a record high of 54 children ages through 17 who were hospitalized for COVID-19. And these are not just incidental tests, like a child's admitted for, I don't know, an appendectomy and they happen to have a positive test. No, these are children who are hospitalized for COVID-19 disease. The purple dots are children ages 5 through 17, and the yellow dots are children ages less than 5. Remember that all those purple dots, they could be vaccinated. They are eligible for vaccine. Every one of these children hospitalized for COVID-19 in South Carolina was unvaccinated. Not a single child vaccinated had disease severe enough to require hospitalization. You know, when we talk in public health about what we can do to make a difference, things like clinical interventions, you know, treating people in hospitals, that's very resource intensive. You know, it takes doctors, nurses, machines, medicines, takes a lot of effort to make a difference. If we want to look at something that can be long-lasting prevention, that's where vaccination comes in. You know, you vaccinate somebody once, twice, give them a booster, and then you're done in terms of preventing severe ramifications of disease. So I know I'm going to be focusing a lot on vaccination, and I know the people who are unvaccinated may still feel unready, but I hope that I can answer some of your concerns and questions about vaccine today. And one of the things I want to do is look to the experience of New York City, because New York City was hit hard earliest in this pandemic, and they continue to be hit hard. So they are having a surge in New York City much greater than what we're seeing in South Carolina. And I think we can learn from it. So in terms of their weekly cases, yes, they have had an increase in breakthrough cases among people who were vaccinated, but it pales in comparison to how many new cases they are having in New York who are not fully vaccinated. And it's not all about cases, right? I keep saying that. It's about who gets severe disease. That's where we really worry. It's the same pattern. For weekly hospitalizations in New York City, yes, there has been a slight increase now that the Omicron variant is in New York City. They've had a slight increase in hospitalizations among people vaccinated, but it's nothing like the number of cases among people who are not fully vaccinated. And similarly for weekly deaths, the majority of those deaths are among people who are not fully vaccinated. So my bottom line of showing this is to say, you know, vaccine does work against Omicron. You know, we can talk a little bit about why is that variant different. It spreads more easily. It doesn't look like it causes more severe disease, but it definitely makes a difference whether you're vaccinated or not. Now let's move back to South Carolina. This is our vaccine dashboard. Where are we with vaccine? The top row shows the number and percent of people who've had at least one dose of vaccine. So everybody age 5 years and up, at least 61% have had at least one dose of vaccine. And the second row shows that 52% of people have completed their primary series, meaning that they've got either 2 doses of Pfizer or Moderna, or they've got a single dose of the Janssen or Johnson & Johnson vaccine. For kids ages 5 through 11, those numbers are much smaller. 14% have received one dose. Almost 9% have completed the vaccine series. And I think a lot of times parents feel, well, my child is healthy. I'm not worried about, you know, my child getting COVID-19. It's just a bad cold. That is true for most children. Most children do not get severe disease. But remember what I showed you a few slides back. You know, we've got 54 kids on a single day in the hospital. That might not sound like much, but those were entirely preventable. You could prevent all those kids age 5 through 17 from being in the hospital by vaccinating them. I want to mention testing programs in schools just for awareness to make sure people know about this. And if your school is not doing this, you might want to talk to your school administrator about this possibility. We have a number of different things that we can do to mitigate COVID-19. Vaccine is one of them. Another one is just increasing testing. But I know right now around the state, there have been long lines to get PCR testing at some of the testing sites. I know that it's been a challenge to get over-the-counter at-home tests if you were going to buy them yourself. But there is funding through DHEC to do testing programs in schools. We can either supply the schools with free rapid tests, and there have been 40 school districts and 13 charter schools who have taken advantage of the Binax Now program, and 19 private schools who've taken advantage of the Q program. Those are tests that would ask either the school nurse or someone else trained to administer the test to do them. But I also know school nurses are overwhelmed right now. And there are programs where you can get turnkey testing vendors. By that, I mean having an outside group outside of the school. So it's not taking up school personnel, teacher, nurse time. An outside vendor comes in, does the PCR testing. And there have been 39 school districts and 6 charter schools that have gone for that. If your school has a testing program, seriously consider signing your child up for routine testing, because that way we can detect COVID-19 early before it spreads and help to protect not only children and teachers, school staff in the school setting, but help protect the community, help protect your family at home. I want to talk a little bit more about school in terms of the school and child care exclusion list and give you some updates, because I know this has created some confusion. CDC changed their recommendations, and DHEC has reviewed these recommendations, and we concur. The reason why these recommendations were changed is twofold. Number one, we've learned more about the science of how this virus spreads. And this is true for Omicron also. Omicron spreads more easily, and it has a shorter, what's called incubation time, meaning from the time when you were exposed to the virus to when you developed symptoms is about an average, it looks like, of 3 days. Earlier variants, it was more like 5 days. And the most contagious period is in the 2 days before you get symptoms and 3 days after that. So it's those 5 days that are really critical. Now, some people can still be contagious after 5 days, but the degree of infectiousness greatly decreased. On the flip side, we also know that we need to get kids back in school. We need children and adolescents back in-person school. We need essential personnel back at work. We need healthcare workers at work if they are well enough to do so, if they are asymptomatic. So this, I'm going to review both the school guidelines that have changed and some things about workers in healthcare settings. So in the school setting, it used to be, if your child or teacher or staff member tested positive for COVID, they were told you need to isolate for 10 days, stay home, stay away from everybody else in the household, isolate for 10 days. And then if at the end of 10 days, if you've had no fever for 24 hours and your symptoms are better, then you can go back to your usual activities. This is what it has changed to. What's new is now 5 days from the onset of symptoms, or 5 days from the time you had your test if you didn't have any symptoms. You can return to your usual activities after 5 days of isolation if you've got no fever for 24 hours, your symptoms are better. They don't have to be completely gone. You might still have a lingering cough or loss of taste or smell, but your symptoms need to be significantly better. You can go back to your usual activities, but you must wear a mask, because you may still have a low level of virus in your respiratory system that could spread to others. And wearing a mask goes a long way to stopping that spread. You don't need to get retested. And in fact, you shouldn't get retested, because your test will probably still be positive. A PCR test can stay positive for weeks. And the reason it can stay positive for weeks is it actually multiplies fragments of the virus to look for on the test. So that virus isn't necessarily viable, meaning that it's living, that it could cause disease, but you don't want to get a PCR test. So again, if you have a positive test, you need to isolate for 5 days. If at the end of 5 days you're feeling better and no fever, don't get a repeat test, go back to usual activities, but you must wear a mask. Quarantine. Now, quarantine is different from isolation. You isolate when you test positive, when you're infected. Isolation when you're infected. They both begin with I. Quarantine, though, is when you were a close contact. So, for example, in the past, we used to say, quarantine, you need to quarantine for 14 days. That's the best thing. And that was based on the fact that some very few people would have an incubation period, the time from when they were exposed to when they got symptoms, as long as 2 weeks. But that's really very few people. So then that guidance changed to you could quarantine just 10 days. If you were feeling well at the end of 10 days, it was okay to go back to your usual activities. And then we even said 7 days with a negative test. What has changed is, again, based on both the science of we know that the incubation period is shorter in general with Omicron, and what we know about the need for people to get back to critical activities. The new quarantine, this all relies on a person having no symptoms. So a person was exposed. They were a close contact to somebody who tested positive. What should they do? They should go home. They should go home and quarantine. No going to school, work, the grocery store, stay home. The 3 new options are stay home for a full 10 days. You know, some people are doing that just to be ultra conservative. Some schools are doing that, or there might be some other reasons why a person might want to stay home for a full 10 days. But most places are going to a quarantine of just 5 days. This all requires having no symptoms because, of course, if at any time you have symptoms, you should get tested to find out for sure whether you might have COVID-19. You've been exposed, go home, quarantine for 5 days, and monitor yourself for symptoms. Take your temperature. You know, look to decide whether you're having any symptoms that might be consistent with COVID. And if you have symptoms, get tested. But if at the end of 5 days and you're feeling fine, you can go back to your normal activities. If you have a negative test, you can get a rapid test. A rapid test can be done in this situation. A rapid test is negative, but when you go back to normal life, you must wear a mask for 6 to 10 days. Now, some schools may require the test, other schools might not require the test, but everybody must require wearing the mask. There's also a test to stay program in schools. I'm not going to say anything more about that for right now. In case there are questions, I mention it, that only a few schools have implemented that. Now, what about healthcare specific guidance? You heard and Lewis talk about, well, we've had to institute certain measures with allowing employees to come back early because we were in contingency or crisis mode. What do we mean by that? Well, you know, we've always treated healthcare guidance around COVID-19 a little bit different from community guidance. And there are a number of reasons for that. Among the reasons are the fact that, on the one hand, they are critical infrastructure. So we want to get them back at work as soon as possible. But they're often working with critically ill people. They're working with a concentration of potentially infected patients, so they're at higher risks. And you worry about, you don't want to accidentally infect somebody else that you're seeing for another reason. So in general, in healthcare settings, they use personal protective equipment. You know, there are a number of different interventions to try and prevent transmission of disease. So it's no surprise to me that sometimes there are different guidelines for the school setting, the normal work setting, and the healthcare work setting. Anne alluded to some of these work restrictions, and I won't go into detail here. This is the sort of thing that is a local decision. You know, whether you just go with the usual no work, special restrictions, where maybe you have 10 days quarantine or 7 days quarantine, or go even with the 5-day quarantine measures. But if there are real severe shortages, and I think In the hospitals in South Carolina right now, we don't have a lot of personnel shortages, but it's the outpatient centers that are really getting overwhelmed with seeing sick people who are not so ill that they need to be hospitalized, but they still need medical care. They need monoclonal antibodies. And as I've heard, CareSouth Carolina has had to go to some contingency or crisis modes. What does that mean? That means even a person who is infected, that top row, they've been infected with SARS-CoV-2, but maybe they have no symptoms or mild symptoms. Their chance of spreading it to others is very low. And in contingency planning, they could go back to work after 5 days of isolation. And again, they don't need to get a negative test. In fact, if they tested again, chances are it might still turn out positive. Crisis measures, crisis restrictions would be no work restriction. That as long as the person is able to work, they're not so ill that they are able to work, they can still go back. Unfortunately, in South Carolina, we are having some situations where we need to go to crisis measures with healthcare providers. So, as I walk you through all these different measures, I think the point that I want to make is that, yes, we have a surge in cases. We have an increase in hospitalization and deaths. Hospitalizations and deaths are not at crisis mode, but that surge is really stressing out our emergency departments and our FQHCs, our clinics, our outpatient services. The only time you use contingency or crisis strategies is when you know that the benefits are going to outweigh the risk, that the risk for healthcare associated SARS-CoV-2 transmission is higher, but the risk of not providing services is an even more serious consideration. I mentioned that this is based on the science of the period of infectiousness. I just want to show you the data that I'm not just saying that, I'm not just reading that from a headline. Here's the evidence for it, that this was data looking at a review of 113 studies from 17 countries looking at the course of SARS transmission. So on the X part of the bottom part of the graph, that's the number of days. And if you look at that 0 point, that's at the time a person tests. That's their period of infectiousness. So 0 is the time of the test. And if you look back for the 3 days before the test, you still have increasing amounts of virus in their upper respiratory system. It actually peaks not at the time of the test, it peaks just a little bit before the test, and then it comes down gradually. Most of the infectiousness is in those first 5 days, but it is still possible to have a low level of virus in your system on day 6. That's why it's so important to continue wearing a mask if you go back to your usual activities, to protect the people around you. In terms of the quarantine, I mentioned 5 days quarantine. That's for people who are not vaccinated. If you're fully vaccinated, if you're 18 and older and you've been fully vaccinated and got your booster, if it's been at least 5 months and you're due for your booster, you don't need to quarantine. Let me repeat that. If you are vaccinated, and if you're over 18, that includes getting the booster, or if you're 5 through 17 years old and you're fully vaccinated, you had your 2 doses of Pfizer vaccine, you do not need to quarantine. You can continue going to school, go to work, your usual activities. You do not need to quarantine. Why? Because infection is rare among people who are vaccinated. It's possible, but it is rare. So if you have no symptoms, and you're vaccinated, you don't need to quarantine. There are a couple of other people who don't need to quarantine, people who have had an infection within the last 90 days, because reinfection is rare within 90 days. So if you had prior infection, and I mean proof of prior infection, that you've got a documented test, you don't need to quarantine. You have to be without symptoms, and you should still wear a mask for 10 days. And this recommendation is not just for the school. This is the same general recommendation for the general public. This is what most businesses are doing as well, that if you're fully vaccinated and have had your booster, no need to quarantine. I want to mention this term that I've seen in the headlines lately, flu-rona. What is flu-rona? Well, this is not influenza and COVID-19 virus somehow recombining into a superbug. It's the fact that people can get two infections at the same time. It's always been possible to be infected with both influenza and COVID-19 at the same time. And we are starting to see cases of that. We are seeing that in South Carolina. Both COVID and influenza are circulating at very high levels in South Carolina. Can you imagine how you might feel being infected with both of them? Disease may be more severe if you're co-infected, infected with both of them, or one right after another in a 1-2 punch. This does happen with other respiratory viruses, so this is nothing special or unexpected. What's important to know about this is it's preventable. You can prevent this. This is not some new superbug. There is a vaccine for influenza and a vaccine for COVID-19. You can get both. You can get both on the same day. And if you previously had influenza, remember you can get it again. There are 4 different strains circulating. So if you feel like, oh, I already had the flu, I'm not going to bother getting that flu shot, you might want to think again, because there are 3 other strains out there circulating. So getting the flu shot, there is a flu vaccine available for everyone aged 6 months and older. You're allergic to eggs? Doesn't matter. There's a flu vaccine for you. You don't like shots? That's okay. There's a flu vaccine for you that they can spray up your nose. You're older than 65, there's a special higher dose flu vaccine for you. You're pregnant, there is a vaccine that is safe for use in pregnancy. And again, that COVID-19 vaccine is available, safe and highly effective for everyone age 5 and up. Let's talk a little bit about Omicron. Does it cause less severe disease? To my point of view, the answer to that is maybe. And let's go through what evidence we have about this. But I know I've also heard rumors of people saying, maybe I should deliberately get infected with Omicron because it's milder. And if I get infected, I'll gain immunity. I don't think that's a good idea. I think a far safer way to get immune is to get vaccinated. But let's talk about the evidence here. I'm not just voicing an opinion. Where did this idea come from that Omicron is more mild? Well, here's one of the places it comes from, the data from South Africa. So let me walk you through this figure. In orange are the number of cases. This is going back to December 2020 through January 2022. So you can see that orange is the number of cases, purple are the number of deaths, and the lighter purple is the number of hospitalizations. So you see a surge back in December, and then the numbers go down, and then all 3 of them surge again in the summertime, and then they go down again. But the pattern right now is pretty different from those other 2 surges, isn't it? The orange line really peaks up, a lot of cases, but the hospitalizations don't go as high and the number of deaths don't go as high. That is what led people to conclude, oh, Omicron, not as severe as Delta or the other variants because we're not seeing as many hospitalizations and deaths. That might be true, but I want to put another idea in your head. What else does it say on this slide? It says, talking about more than 70% of South African residents have been previously infected. And it says the median age in South Africa is really pretty young, 38. Let me show you another study. This is from the Journal of the American Medical Association, looking at who was hospitalized with COVID-19 in South Africa. Because we know that the wave this time around with Omicron is nowhere near as big as the previous hospitalization waves. Well, the point they made in this article is that they estimate that about 44% of adults in South Africa have been vaccinated, and that there's evidence that more than half of the population had prior COVID. So if there are fewer hospitalized people right now in South Africa, it may be because it's a very different patient population than we saw in those other surges. These people are younger, they have fewer comorbidities, meaning other medical problems like diabetes or obesity, and they have very different immunity. If you've had COVID-19 before, it's true, you have some degree of prior immunity from that prior infection. So when we look at South Africa, where more than half have had prior COVID and 44% are vaccinated, of course we have fewer hospitalizations because that immunity helps to protect them. So is Omicron milder? I don't think the word is completely clear on that. Do people still need to mask up? I would say yes, and here's why. The Omicron paradox is maybe it is milder, but it is so much more contagious. We have so many more cases, and people are letting their guard down, that surge in cases is overwhelming things, overwhelming schools, work, and medical systems. Because if we look at hospitalizations, I think it's a real disconnect to think, oh, Omicron is mild, because right now we're at the highest number of people hospitalized for COVID ever. So last year, the peak was 128,000 people hospitalized on a given day. Last year, we've exceeded that peak with over 145,000 people hospitalized on a single day in the United States with COVID. I do want to review a few of the prevention and treatment options, but right from the start, I want to point out that a number of these treatment options are either poorly available, they're in really short supply, or they don't work well against Omicron. And Omicron is rapidly taking over as the main variant in South Carolina. So let's just mention them though, one at a time. There are two different pills. Paxlovid, this is made by Pfizer. These are pills that you have to start within 5 days of a positive test. It's almost 90% effective in preventing hospitalization. That's really awesome, but it's in very, very short supply. So it's being used only for people who have severe medical problems or immunosuppression. It's not something that would be routinely given to other people with COVID-19. And it's got, unfortunately, multiple drug interactions. So there are a lot of people who can't take it because they're on some other medications. It's only for people over age 12 who weigh at least 88 pounds. So it doesn't work for children. Molnupiravir is another one, but you got to start it within 5 days of your positive test. So these pills only work if you get them into your system right away. And it's not as effective. It's about 30% effective in preventing hospitalization. And again, it's in short supply. And it's got some warnings with it. Can't take it if you're pregnant or trying to get pregnant. It's only for people age 18 and older. Monoclonal antibodies have long been a real mainstay for us in preventing severe disease. However, the bad news is the Lilly and Regeneron products that we've been using as monoclonal antibodies, they don't work against Omicron. That means that we don't have a monoclonal option for kids under age 12. There are only 2 monoclonal antibodies that work against Omicron. Sotrovimab and Evusheld, and again, they are in really short supply. So if you're depending on them, if you're thinking, well, if I get COVID-19, I'll just get those monoclonal antibodies, I think you should reconsider. The 2 that are readily available do not work against Omicron. And the ones that do work are in very short supply. So chances are that if you went to try and get treated with those monoclonal antibodies, they wouldn't be available to you. And honestly, even though all of these things are effective, we're talking about 30, 70, 89% effectivity, the truth is the most effective thing in preventing severe disease is still immunization. The Pfizer or Moderna vaccines plus the booster at 5 months, they can offer 95% effectiveness in preventing hospitalization. Now, we've all heard about breakthrough cases. We've all heard that somebody who was vaccinated, then maybe even they got the booster, and yet they got COVID-19. What's up with that? Why bother getting vaccinated if you can still get infected? Well, the purpose of vaccine is not to stop you from getting the sniffles. The purpose of vaccine is to stop you from needing the hospital. If we look at our data in South Carolina, over 2 million people have been fully vaccinated. And of those, only 31,969 have had a breakthrough case. Now, maybe 32,000 sounds like a lot of breakthrough cases, but that's out of over 2 million people. So that's about 1.3% of people who have had the vaccine have had COVID infection. And if we look at seriousness of cases, like how many of those people ended up in the hospital or died, it is very small percentage of those people who have had serious disease. Vaccine blocks serious disease. And if you look further, who are these people who get COVID-19, severe COVID-19, who are fully vaccinated? This is a study, over 1 million people throughout the United States. This is not just South Carolina, over 1 million people age 18 and older from December 2020 to October 2021. Again, nationally, people who are fully vaccinated, 0.015% of them are hospitalized, and death in 0.003. I mean, death and hospitalization is rare, but who are those people who get hospitalized and died? They're the people for whom vaccines really don't take as well. People who had a combination of features, such as being immunosuppressed, meaning you're on cancer chemotherapy, or maybe you had a kidney transplant and you're on transplant medicines, age 65 and older, or other underlying conditions, diabetes, chronic liver, lung, heart, or neurological disease, nervous system disease. Most of the people who died had 4 or more of these conditions. So vaccine still keeps most people safe, out of the hospital, out of the morgue. And if you look back a year ago, remember I said we're in a very different position than we were this time last year. Prior to vaccine being available, about 10 to 20% of COVID infections ended up hospitalized, and about 2% of people died. If you compare that to now, if you're fully vaccinated, that vaccine has radically changed this equation. So before vaccine, your risk of hospitalization was 1 in 5 to 10, and your risk of death is 1 in 50. But if you're fully vaccinated, your risk of hospitalization is 1 in 10,000, and risk of death 1 in 30,000. We have the tools to fight Omicron. Masks, vaccine and booster testing, those things all do continue to work against Omicron. Omicron is a variant that spreads more easily, but I don't want to be fooled into thinking it's milder, so I'm not worried. I don't want to overwhelm my healthcare system. I don't want any kind of COVID-19, not even Omicron. I'm going to finish this slide with my email address. If you have any questions that aren't answered today, you are welcome at any time to email me directly, kellyjm1@dhec.sc.gov. Thank you so much, and I am going to go ahead and open things up to questions.
Thank you so much, Dr. Kelly. I was in rapt attention.
Well, I feel so much of the time headlines are produced without the background information. For example, you may have read about, there's evidence that with Omicron, the virus really stays more in your upper respiratory system. It doesn't get down in your lungs. Do you know what that statement is based on? A study in hamsters. So, okay, good for the hamsters, but I'm not so sure. I mean, it's a good study. You do studies in animal models first to get information, but I'm not ready to just completely translate that to humans and just accept that the same thing is true in humans.
Exactly. We do at CareSouth the monoclonal antibody infusion. And in talking to the folks that are over there in our location for doing that, they are saying the same thing. It doesn't just stay in your head. We're still seeing folks that have pulmonary issues and so forth, and serious ones. So this is not the whole story of it being a mild one. So thank you for all of that.
And I do want to emphasize, it's not as though there's nothing we can do. We're not helpless. When I spread the word that I'm concerned, Omicron is surging, I'm concerned that it might not be as mild as everybody's saying. I do also want to spread the message that there are things we can do. And the most important thing we can do is get vaccinated. And if I sound like a broken record on that, it's because I as a healthcare provider, as a physician, I have seen in my career the difference between people who are vaccinated and not. Now, in America, Most people are vaccinated for all those childhood diseases. But I've been to other countries where kids don't have access to those vaccines. And I have literally seen people die from chickenpox, measles, tetanus. I've seen kids paralyzed from polio. Most people don't have that experience. So I think people don't appreciate what a huge difference a vaccine can make. And that's true for the COVID vaccine as well. I understood a year ago when this was really new and people were saying, I'm afraid to get vaccinated, but I'm afraid not to get vaccinated. I'm just going to wait. But it's been more than a year. We've had over 500 million doses of these vaccines given in the United States with very little in the way of side effects. So if people still have questions about vaccine, I would encourage you to not just look at social media because there's a lot of misinformation and there's fear mongering going on out there. If you don't trust government websites, go to a school of public health website. There's information on the Morehouse School of Medicine website. There's information in the Yale School of Public Health. Choose a school of public health information that you feel you have more faith in. If you don't want to look at government websites, educate yourself, get your questions answered.
Yeah. Speaking of questions, we did have a question that came up. Like I said, I shared slides, and we did have a question that came up, and it was very interesting. And Marek's kind of nodding with that because we have been hearing this in more than one setting. So, if a person has COVID, but they still want to get vaccinated or boosted, how long do they have to wait after their COVID or whatever, after they get over it?
I'm so glad you asked that question because I think there's been confusion. I know there's been confusion on this. If you had monoclonal antibodies, so if you got that infusion or series of injections with monoclonal antibodies, you need to wait 90 days because otherwise your body will look at the vaccine and say, oh, I already have antibodies to this. I don't need to worry about it. And it won't stimulate your immune system. But if you did not get the monoclonal antibodies, you have tested positive, you can get vaccinated or get your booster as soon as you finish your isolation period. So you can, get vaccinated 5 days after your test positive. Will you have an increase in sore arm or symptoms? There have been some reports that some people have had some more symptoms, but there's nothing serious has come up with that. More of if you're already aching all over, and feeling unwell from COVID, you might want to wait until you're feeling better. By feeling better, I mean no fever, no longer having that aching all over feeling. So you can delay a little bit until you're feeling better, but you do not need to wait 90 days if you had tested positive, but you didn't get the monoclonal antibodies.
I wrote that down and took notes on that. So I'm going to make sure we do everything in our power at CareSouth to get that word out because that really has been a lot of questions. So Marek and Daniel might have some questions that they heard too.
We do have one. There's one there, and I'm gonna let Daniel address that one. That's more clinical.
Okay.
But we do have one other question. Let me get this one out, Daniel. I'm gonna let you have the other one. All right.
Okay.
Mr. Sabisky wants to know: can people who got Johnson and Johnson get Moderna or Pfizer now as a booster or even a vaccine?
Sorry, I thought you were directing that to Daniel, but I'll go ahead.
No, I'm directing to you.
Sorry, yeah. Let me jump in. Absolutely. If you got the J&J vaccine, it is recommended, in fact, that you get your booster of either Pfizer or Moderna. Mm-hmm. And if you want to get the entire 2-dose course of Pfizer or Moderna, you can do that as well. But you should at least, if you got J&J, you should at least get a single booster dose of Pfizer or Moderna.
Yeah.
Is that even if you got the J&J booster as well?
I'm not sure what the official word is on that, honestly, okay. But I know what I would do if I were in that position. I can say that I know people who did go on to get the Pfizer or Moderna, even if they had 2 doses of J&J.
Okay, so I got two questions. Somebody, I just got a question on my phone. If you just got the booster, if you just got the booster and you test positive, is the booster still effective?
Well, the booster will still be effective in preventing progression of disease. So I know it's really frustrating to be vaccinated, boosted, and then you test positive. But we've got so much virus circulating, it's not a surprise that, that what vaccine does is prevents you from getting severe disease, doesn't prevent completely you getting infected, but it should help to protect you from going on to get severe disease.
Okay. And this is a good one. It says, this is from Gloria Miller, and it's talking about acute myocarditis. It says that increasing rates of COVID-19 vaccine coverage will result in more acute myocarditis, myalgia, and febrile sensations and fever. Can you, I guess it's kind of self-explanatory. I guess the more we vaccinate, the more cases we will have. But can you elaborate on that a little bit more?
Yeah, let's put that in perspective. So myocarditis, that's an inflammation of the heart muscle, that has been found as a rare vaccine-associated complication. And this isn't unique to COVID-19 vaccine. Can be seen with other vaccines as well. So I don't want to blow this off as something not serious, but I need to put it in perspective for you. COVID-19 disease also causes myocarditis. COVID-19 disease causes myocarditis more frequently than the vaccine causes myocarditis. Now, what about we've had about 6 million children ages 5 through 11 who have received at least one dose of COVID-19 vaccine. We've not seen a single case of myocarditis in that age group yet. So, that's very good news. The age group most at risk for myocarditis is teenage boys, males age 16 through 17. They get myocarditis at a rate of about 70 per 100,000. Now that's a lot, but 70 per million. What am I saying? 70 per million. Now that's a lot, but to put it in terms of per 100,000, because I think that's what people can visualize. Imagine a stadium, 100,000 people, football stadium, 100,000 people, and they're all boys ages 16 through 17, and they all get vaccinated. About 7 of them are going to get myocarditis. Okay, so just to put it in perspective, whereas how many of them would go on to get COVID-19? Well, with this surge of Omicron, there's a high chance that they would get COVID-19, and more than 7 of them would get the disease. More than 7 of them could get myocarditis from the disease. So in answer to your question, yep, nothing in life is risk-free, but there is less of a risk of myocarditis by getting the vaccine than getting the disease.
And I guess it's understood that the key word in this statement is that it's acute, and so which means it can be treated. And there is care for it, and even when it comes to fever and myalgia, there is medications that help with that as well. So this is a whole lot better. I'm not trying to downgrade it, but it's treatable. It's treatable, and so it's one of those things where you look at, does the risk outweigh the reward? And in this case, it does. So especially with the low percentage.
And do you know what the most common medication they use to treat it with?
What's that?
Ibuprofen.
Yes, Motrin. Inflammation, right? Because it's inflammation. So it's really, really good. So I'm kind of glad we had this talk, because there's a lot of talk in my community that why should I get vaccinated when you're vaccinated and then you getting COVID? Yeah, but I'm walking around and I'm able to I'm able to do things still. But if you're not vaccinated, you might not have the same outcomes I have. So I'm this way because I was vaccinated. It never said that I won't go get COVID. It said that I wouldn't be hospitalized and I possibly wouldn't die from COVID. I said, but when you're unvaccinated, then you're open to all of those categories where you can be hospitalized on a ventilator and you can possibly die. I said, so I'd rather be in my position than yours.
That's right.
And it's not all about hospitalization and death. Also, it's about chronic disease. Like you get a chronic cough, and even if you don't end up in the hospital, but you're like coughing for months at a time. that really impacts your quality of life, or it'll make other diseases worse. You have diabetes, it's going to be harder to control your blood sugar while you're sick with COVID, and that can last for a long time, not just 5 to 10 days. And there is a syndrome of long COVID, people who have symptoms that last for weeks and months, including in children, where they have trouble concentrating, trouble sleeping, and that is greatly decreased with vaccination.
Yeah, Dr. Kelly, I've had some friends tell me that, their COVID was mild. It was just like having a bad cold, and they lost their taste and smell, and they still haven't gotten that back, but they're not worried about it. And I said, well, when that brain infection stops and everybody's aghast, what do you mean I have a brain infection?
Yeah. It causes encephalitis. That's why you lose your sense of smell, because it is in that olfactory section of your brain.
Yeah. Wow. And I think that's where the headaches and everything come from as well, because of that part. But yeah, I was just dealing with getting over dealing with a 18-year-old who just turned 19 today, who was supposed to go back to school last week, but he tested Friday morning negative, came back home Sunday, did a home test because he didn't feel well. He was positive, and he got his booster the same day that he tested negative. And so he's been home all week from college. And so last night when we did the test on the 4th day to make sure he was okay, it was negative. And you should have seen the joy in his eyes. He never got severely sick, anything like that. He just drove me crazy being in the house with me asking me, you think I'm okay today? You think I'm okay today? Can I go outside? So, I just felt confident knowing that he was fully vaccinated and going through this at his age, because this is the age that really don't care. They don't wear masks. They're around their friends, riding the car, just they don't care. And so, but he's been very, very vigilant about his mask. And I told him, I said, it happens. You wear your mask and it happens. I said, but at least you're vaccinated, and now you have something to talk to your friends about and teach them a lesson as well.
Yeah.
Wow. Thank you so much. We could do this all day, but I know you have to go.
I'm sorry, I got a 1 o'clock.
And we're gonna let you go. And we appreciate you coming on and giving us that information. And Miss Ann, we appreciate you coming on as well, sharing some information about CareSouth as well. And
all right.
Thank you.
Thank you so much. And I'd be happy to come back at any time.
Absolutely.
You make a difference, Dr. Kelly. Just know that you're making a difference, and we appreciate it.
Because I know you. I see you're all smiling faces, but I know how hard. I have an inkling of how hard you are working. I want you to know how much we appreciate that.
Thank you.
Yes. If you want any more information about CareSouth Carolina, you can reach us on our website, www.caresouthcarolina-carolina.com. Give DHEC website one more time.
So DHEC website is scdhec.gov.
Absolutely. scdhec.gov. And you could like and follow us on our Facebook page, our Twitter page, and go to YouTube and hit that subscribe button. Subscribe to our YouTube channel as well. We appreciate everything. We appreciate you, Dr. Kelly. We appreciate you, Ann. And this is another CareSouth Carolina Community Live podcast. We see you later.